Hello, everyone, and thank you for listening and or watching this recording. My name is Matthew Schatzkis, and I'm a partner at Sheppard Mullin. Also presenting and on the line today, Erica Kraus, also from Sheppard Mullin, and Heather Spillman, a principal at Citrin Cooperman, and Sarah Hughes, a manager at Citrin Cooperman. We'll provide some additional information about Sheppard Mullin and Citrin Cooperman in a little bit. We're very excited to be presenting on what we believe to be a very exciting, timely, and necessary topic given the world that we're in right now and where things are in the healthcare industry. We put together Citrin Cooperman and Sheppard Mullin put together a white paper about 2 weeks ago. And in that white paper, we addressed and sort of described on a high level and provided predictions about certain of the regulatory changes that we've seen in the healthcare industry, specifically relating to telehealth services. And some of them include, and they're listed here, privacy and security changes, reimbursement, licensure, covered services. And as we described in the white paper, things are moving very quickly. And to that effect, since we've published the white paper, there have been additional changes. And Erica, in a little bit, will provide an overview of those additional changes that we've seen since we've published. And so taking into account all of these sort of changes that we've seen, Sheppard Mullin and Citrin Cooperman wanted to get together and focus not on so much what changes we've seen and how industry, healthcare entities within the industry should respond right now, but more so, where is healthcare going to go? Which of those changes are going to stay? Which are going to go? Where may they be a partial stay or a partial go? And we sort of put our heads together and trying to leverage both of our expertise and knowledge in this area and put together what we've called the telehealth maturity model. And the telehealth maturity model is our way of helping healthcare entities think through how do they develop an adaptable, sophisticated, sustainable, and more permanent telehealth strategy within their overall business plan and their and healthcare delivery model. And Heather later on in the presentation will provide an overview of what the telehealth maturity model looks like and the different components of the model itself. And so in this recording, we will provide a little bit more background and an introduction to both Sheppard Mullin and Citrin Cooperman. Erica, as I mentioned, will provide that telehealth regulatory update, those items which have changed since we've published the white paper. Heather will provide an overview of the maturity model. Sarah will go over the first component of the maturity model, which is the telehealth strategy component. And then we'll wrap up and provide some next steps, and in particular, and most importantly, introduce what we've called the telehealth readiness assessment, sort of the first step on the maturity model to get that going. So a little bit of background and introduction on myself and Erica and the Sheppard Mullin team. As I mentioned, I'm a partner with Sheppard Mullin, and I lead the telehealth practice. Erica, senior associate, is a regulatory Swiss Army knife and primarily focus on reimbursement and regulatory areas. And so she's been very busy during this COVID-19 period. Sheppard Mullin itself is 900 attorneys and 16 offices worldwide. In the US, we have offices from coast to coast, California, all the way to New York. Importantly, we have a number of blogs, and this is a little bit of a plug here. Most importantly, we have now a Corona COVID-19 Coronavirus Insights blog, where you can get information, not only healthcare related information on the coronavirus, but labor and employment and other areas related to COVID-19. Our healthcare team is 165 plus attorneys strong. We've got a number of accolades and awards, including Tier 1 National Healthcare Practice. And we provide full service solution to healthcare entities on the transactional, regulatory, tax, benefits, real estate, compensation, antitrust side. And you can see some of the additional, subspecialties within that broader group that we have expertise in. One of those is certainly telehealth. And on the telehealth side, we've worked with a number of clients on rolling out telehealth programs on a national basis, and we've advised on structural matters, governance, regulatory compliance, licensure, both on the federal side and on the state level, and then finally reimbursement for all payers, commercial, Medicare, and Medicaid. So we have a robust team, and there are many others on the telehealth team in addition to just Erica and myself. I'm now going to turn it over to Heather to introduce her and Sarah and the Citrin Cooperman team.
Thank you, Matt. As Matt mentioned, my name's Heather Spellman, and I'm a principal with Citrin Cooperman. I'm out of our Austin, Texas location, but we have healthcare services across the U.S. So we've been primarily focused on the eastern seaboard, but we are a national practice, and I happen to be in Austin, and Sarah happens to be in Nashville, another important healthcare industry city, of course. And Sarah's a manager with our telehealth practice as well. We are both within our strategy area. We do a lot of things with M&A services. We do a lot of transactions, and we provide kind of full cycle consulting services to our clients. I think we can go to the next slide. So here's just a little bit of information about our firm. We are a top 25 audit, tax, and advisory firm, and we provide, as I mentioned, services to clients across the country in a variety of different areas. Healthcare is one of the industries that we focus on, but we focus on many other industries as well. We've got more than 1,300 partners and staff across the U.S., and as I mentioned, our traditional footprint has been more or less along the eastern seaboard, but we do have offices in California, and then we've got staff and partners across the U.S. and other locations as well. And here's a little bit more about our healthcare practice. So we've kind of divided ourselves very traditionally into the advisory services, the tax and business services, and the audit services as well. As I mentioned, Sarah and I both fall into the advisory services, where we're focusing on working very closely with clients across the entire ecosystem of healthcare, providers, payers. We work with providers of all different types, post-acute, traditional physician practices. We work with health systems. We work with community hospitals. And then we also work with different organizations that are becoming more and more involved with healthcare, like private equity, venture, and some of the other pieces as well. Banks partner with law firms very frequently. So in the healthcare advisory space, we do a lot of strategy work. We help with execution work. A lot of my time is spent really at the center of merging the strategy with the transformation efforts of organizations. So helping them deploy transformational strategies within their organizations. Telehealth is an excellent example of one of the types of strategies that we're working with people to help them execute at the organizational level. We also spend a lot of our time with transactions. Sarah does a lot with our M&A team. We work very closely with banks. We work very closely with other sorts of private equity organizations, and on both the seller and buyer side as well. We've got a full tax and business services practice as well that works across the entire healthcare ecosystem as well. And then we have a full audit practice. In totality, we have over 700 clients in the healthcare space, again, representing a different smattering of focus areas within healthcare. All right, I think we're going to transition it over. As Matt mentioned, just about as soon as we started and released our white paper, there were regulatory changes very quickly. So Erica is going to run us through some of those. I know that's one of the areas that people are most interested in, is how can they kind of be responsive and reactive to the different regulatory changes that are coming out.
Thanks, Heather. And as anybody who's been working in the healthcare arena is aware, we have had just rapid fire regulatory changes from CMS throughout the COVID-19 crisis, and this area is no exception. So we can't underscore enough that things continue to change very quickly. Even since the white paper, as Heather mentioned, we've had additional changes and we could easily see more. So what we're talking about today are the changes we know about. They could change again, and we'll try to keep everybody updated, but no guarantee that what's true today will be true tomorrow. We have some other just housekeeping disclaimers here. The information we're providing today is not legal advice to you. This is just an overview of what we're seeing out in the world. The webinar does not address the potential impacts of the numerous other applicable local, state, and other federal laws. There are just too many out there for us to possibly cover today. It's not intended to be a summary of all the orders that have been issued by various governmental agencies at every level in response to the COVID-19 pandemic, and it's for informational purposes only, not specific legal advice to anybody who's watching or listening today. So Medicare, in a lot of ways, has had its hand forced into taking a great leap forward in Medicare coverage of telehealth services. Up until the pandemic, Medicare was very much behind what technology is capable of doing and what a lot of other payers were covering in terms of telehealth services. And in our white paper, we've summarized quite a few of the different regulatory changes that CMS has put into place over the course of the COVID-19 pandemic. And we summarized just a few of the key changes here on this slide. Probably the most important of these changes related to the originating site requirement. So as many of you may be aware, prior to COVID-19, Medicare imposed an extremely restrictive originating site requirement on coverage of telehealth services. For Medicare purposes, the originating site is where the patient is located. And Medicare required, in order to cover telehealth services, that patient be located at a qualifying originating site, which was limited to healthcare facilities. So patients couldn't be at home; they had to go to a healthcare facility to get covered telehealth services, and it was limited to healthcare facilities in specific, mainly rural areas. So most of the telehealth services that a provider might offer to a Medicare beneficiary were not going to be covered by Medicare as long as this requirement was in place. In response to COVID-19 and the need for both patients and providers to practice additional social distancing, CMS has waived this requirement, which just on its own has been a massive expansion of the services that Medicare covers. Medicare had taken some baby steps to recognizing the additional remote services that providers have been offering to Medicare beneficiaries. And that was not so long before the COVID-19 pandemic occurred, by covering certain communications-based technology services that providers were offering to their patients. But those services were limited to patients who had a pre-existing relationship with the provider. That's another requirement that Medicare has waived in the face of the pandemic that's made a big difference to providers trying to offer more services to their patients and to get paid for those services by Medicare. Another big change, which relates then beyond Medicare to all different healthcare services that providers might be offering remotely, is a waiver of HIPAA requirements for the kind of technologies that providers need to use when providing telehealth services. And this is the waiver that allows providers to use things like Skype or Facebook Messenger or Zoom to provide these services, as opposed to specialized, more secure services. And that's allowed a lot of providers to jump into telehealth when they weren't doing it before. CMS has also offered reimbursement for audio-only telephone codes for visits that doctors are providing via standard telephones without video capacity. And we've actually gotten even more flexibility in that area, which I'll talk about in a minute. Another big change has been Medicare's allowance for providers to practice across state lines without being licensed in the additional states. So prior to this waiver, for instance, if I were sitting where I am in Northern Virginia and I called up my doctor who was sitting across the Potomac River in DC, and my doctor provided me healthcare advice, then potentially my doctor would be practicing medicine in Virginia, where I'm sitting without a license to do so. And that's a big issue for telehealth services, which can obviously be provided pretty easily across state lines. So in the face of COVID-19 and the need to make healthcare services remotely much more available, much more quickly, CMS waived that requirement. CMS has also pretty radically expanded the services that can be provided via telehealth and covered by Medicare. So they had added 80 codes to that list as of the time we wrote the white paper, and have subsequently added even more codes. So a lot more services can now be furnished via telehealth. And Medicare is also reimbursing telehealth visits now at the same rate as in-person visits. Prior to COVID-19, telehealth visits had to be coded with a place of service indicating that they were telehealth visits, and then they were paid at facility rates instead of non-facility rates. So payers took a pay cut of their services when they provided telehealth visits, and that's not true anymore. So the overall effect of these changes is just a radical expansion of Medicare coverage of telehealth services. And you can think of this as changes in where telehealth services can be furnished and still get Medicare coverage. And so things like site restrictions being lifted allow telehealth services to be provided to patients wherever they are by providers wherever they are. Lifting licensure requirements allows the patients and providers, again, to sit anywhere at all and exchange telehealth services. We've also seen flexibility in terms of how telehealth services can be furnished. So prior to COVID-19, a lot of providers interpreted CMS's regulations not to allow the use of smartphones to provide telehealth services. CMS has been clear that at least during COVID-19, smartphones aren't acceptable technology to use for telehealth services. Additionally, the HIPAA waiver allows the use of all sorts of different platforms to provide telehealth services. So that has hugely expanded the ways in which providers can offer telehealth services. And we also see more flexibility on what telehealth services can be provided, with a much longer list of codes that can be provided via telehealth. And we've also seen additional reimbursement for telehealth. And these have all been really important in encouraging providers and making it possible for providers to offer telehealth services in more instances and to more patients. So as Matt and Heather mentioned, just after our white paper was published last week, CMS put out a whole slew of additional flexibility, some of which related to telehealth. One of these, which the provider community had really been pushing for, was an expansion of the practitioners who can offer telehealth services. So under the Social Security Act, there's a pretty limited set of practitioners who are allowed to offer telehealth services for Medicare reimbursement, those being doctors, advanced practice, clinicians, dietitians, but not many other folks. And there had been many requests by the provider community to expand that list. CMS took the position that it couldn't because it was limited by the statute. Congress went ahead and acted and gave CMS additional flexibility to allow other providers to furnish telehealth, and CMS took that flexibility and ran with it. So now virtually any clinician can furnish telehealth services and get Medicare reimbursement for those services, which is hugely helpful, especially given that CMS, when it expanded its code list, included a bunch of therapy codes, but didn't allow therapists to then provide the therapy codes and get Medicare coverage. This is going to make those therapy codes a whole lot more useful. CMS also addressed a lot of concerns that it's been getting from the provider codes, that there are beneficiaries out there who are unwilling and unable to use video functionality on a smartphone to get their telehealth services. And so doctors are providing pretty involved visits via audio-only telephone calls to those patients. And so CMS is recognizing this in two ways. First of all, they're allowing some additional services beyond the telephone codes to be furnished via audio-only telephone calls, and those are behavioral health and education codes that CMS believes can be provided via audio-only phone. And CMS is also enhancing reimbursement for the audio-only telephone codes, which were really very low before, and CMS is substantially ramping up reimbursement for those codes to recognize the work that providers are putting in via telephone calls, which personally I'm extremely excited about. Just thinking of my grandfather who's 90 years old and trying to do an audio-only telephone call with my grandfather, a provider should get very good reimbursement for that experience. So I think that was the right thing to do, and hopefully will expand access to beneficiaries who aren't able to use video functionality on their smartphones very effectively. And finally, CMS provided some flexibility and clarification around hospital billing for telehealth services. So this is in some ways very COVID-19 specific, but there are a lot of cases now where you have a hospital outpatient who's not actually in the hospital. CMS has provided a lot of flexibility for hospitals to provide hospital services in alternate locations, including in patient homes. So in a lot of cases now you have hospital outpatient at home receiving hospital services. And so CMS is allowing now that the hospital in those cases can be an originating site and bill as an originating site for that patient, even though the patient is physically located in their house. So for hospitals, that's an important flexibility. So just to look back at the changes that we've seen, as you might have gotten the sense of talking about these regulatory changes, before COVID-19, Medicare coverage was extremely limited. And this gets back to that originating site requirement, which really ties Medicare reimbursement to a very specific use of telehealth, which is to connect specialists to patients in areas where specialty care is unavailable. And telehealth really didn't go very far beyond that prior to COVID-19 in terms of Medicare coverage. As I mentioned, CMS took kind of a baby step towards recognizing more remote services via its codes for communication technology-based services, but this is a pretty limited set of codes. They cover things like electronic communications between patients and doctors. They don't cover full-blown telehealth that providers may have wanted to and patients may have wanted to engage in. It was also limited to certain practitioner types, which is also changed in light of COVID-19. So again, it was that more limited doctors, advanced practice professionals. Now we're seeing much more clinicians who are able to provide those kinds of communication technology-based service codes. So what does Medicare telehealth coverage look like now? I can't overemphasize how different it looks. The scope of what is covered is just worlds apart. So really, we have seen changes in terms of where telehealth can be provided. All of a sudden, instead of only being provided in healthcare provider sites in rural areas, it can be provided literally anywhere to a patient sitting anywhere, which is a huge change. In terms of how telehealth can be provided, we've seen enormous expansion as opposed to having to have a whole full-blown video audio system that you'd only find maybe in a healthcare provider site. You can do it via your smartphone sitting on your couch. Again, a tremendous, tremendous change in the ways in which providers and patients can reach one another for telehealth services. In terms of what's covered, again, the code list has just drastically expanded. And in terms of who can provide telehealth, we're seeing a change from only practitioners with the most advanced licenses to almost every clinician being able to provide telehealth services, which allows patients to get different kinds of care from different kinds of clinicians and to get their needs served by the most appropriate people in the most appropriate way. In addition, we've seen improvements to reimbursement, which makes telehealth much more viable for a lot of practices. So here's what I think is the million-dollar question. What will Medicare telehealth coverage look like after COVID-19? And of course, the answer is that no one can know for sure, but it would be really hard for Medicare at this point to put the cat back in the bag. In other words, the secret's out. Telehealth works. We can do this. Patients like it. Doctors like it. And it would be very difficult for CMS, after everybody's experienced how important telehealth can be and how well it can work, to turn it around and drive it back to the extremely limited scope that it had prior to COVID-19. So we've made some best guesses as to which of these regulatory flexibilities are likely to remain in place and which might be pared back after COVID-19. So one that we think is likely to stay in place is the elimination of the site restrictions. Again, while these site restrictions are in place, there's just so little flexibility for providers to offer covered telehealth services. Now, there's a challenge for CMS here because the site restrictions are statutory. So CMS is going to have to find a way to either work with Congress or to do some very creative regulatory work to keep these in place after COVID-19. But I think there will be tremendous pressure on CMS to do exactly that, because again, these site restrictions really make it impossible for Medicare to meaningfully cover the scope of telehealth services that patients are going to want and that providers are going to want to offer. So we think there's a good chance that CMS will find a way to get that done. In addition, we think it's likely that CMS will continue to allow smartphone use to provide telehealth services. That one's an easier one for CMS because the statute is ambiguous enough to allow that without a statutory change. And again, it's been popular, it's been effective, so it's very likely, in our view, that that one will stay in place. In terms of other changes, the audio-only changes, we tend to think that's maybe a partial stay. So the expansion of codes for behavioral health and education to allow for provision via audio-only telephone calls, we think there's a good chance that CMS might run with that as long as it's working well. These are services that CMS wants to see provided more and wants to see better access to, and that can, in many cases, really effectively be provided via audio-only telephone. So CMS would have a good incentive to keep those in place. In terms of the enhanced reimbursement for the telephone codes, especially the most recent enhancement, it's pretty significant, and it's less likely that CMS will leave that in place. It's a lot of money for CMS to spend, especially when it feels much less pressure to rapidly expand access to services. So it's less likely that we'll see those reimbursement enhancements stay in place, at least in the immediate term after COVID-19. Some of the other changes, the expanded code list, some of those may stay, especially if CMS is thinking it's working really well to have those reimbursed via telehealth, but it's been a lot of code and they have been increased very rapidly. So there's a good chance that not all of those will stay on the telehealth list after COVID-19. This is especially true after the most recent rulemaking, which allows CMS to add codes via sub-regulatory guidance instead of going through notice and comment. That's great during COVID-19 because it allows CMS to work very quickly, but it could easily mean the addition of codes that CMS maybe hasn't done its usual level of investigation prior to adding and might decide to roll back after the pandemic. The practitioner expansion, so allowing folks beyond the doctors and the advanced practice professionals to provide telehealth services, we think there's less likelihood of this one continuing. This is, again, an area where there's a statutory restriction, so it would be difficult for CMS to move this beyond COVID-19 without Congress's cooperation. And unlike the originating site requirement, this one doesn't have such a tremendous impact on holding back Medicare coverage of telehealth services, so there may be less incentive for CMS to push the envelope on this one. The reimbursement increases where practitioners are getting the same reimbursement for telehealth visits as in-person visits. We think we probably will see rolled back for similar reasons. Without that incentive to rapidly expand the access to these services, CMS is much less likely to want to pay more for these services, again, at least in the short term. As these services become more normalized and CMS adjusts to telehealth being a more normal means of provision of healthcare services, we could see some of these changes come back. We could see reimbursement go up as providers demand it more and more. We could even see that practitioner expansion come back over time, but these are changes that we think in the short term are less likely to stay in place.
Well, that's a great lead into the maturity model and some of the pieces that we think that organizations need to be thinking about as they're looking to pivot what they might be doing from a response standpoint to a long-term strategy. So we put this out as in our white paper as kind of what we think organizations need to think about as they're evolving their responses into a long-term strategy. So we understand organizations right now are doing anything they can to kind of get to market quickly with telehealth services. So if they didn't already have a robust telehealth service portfolio before, they're trying to get to market very quickly to stop the loss of volume, to kind of shore up some of the economic pieces of it, and just make sure they're in a sustainable place when we kind of can see around the corner around COVID-19. And we understand that's kind of where people need to be focusing today. But what we would also suggest is that organizations take a look at that and think about how they then build on the pieces that they're putting in place today into something that's adaptable and sustainable for the future. As Erica mentioned very well through her part of the presentation, we believe that telehealth is here to stay. The cat is out of the bag. I've also heard that, the genie's out of the bottle. We don't think this is going anywhere. We think that that COVID-19 probably accelerated the efforts that were already underway due to a lot of pressures, everything from consumerism to the price of healthcare to a lot of different pieces that were already in place. We think that COVID-19 really accelerated those efforts. So organizations that maybe didn't have this as an integrated part of their overarching strategy are going to need to think about it very quickly moving forward. So when we look at our maturity model, we build it around 3 different phases. So the initiate phase, the develop phase, and the optimize phase. The initiate phase really is representative of organizations that are just getting into telehealth. They may or may not have a vendor. They may be today using some of the relaxed regulations to provide it via something like FaceTime or another quick solution like that. But they are going to probably pretty quickly need to start looking at how they identify a vendor to work with longer term in some capacity. The develop phase is what we're considering more moderately mature organizations. So they probably already had some sort of telehealth solution in place, but it's not integrated into their overarching business model yet. These are the ones that we would consider more or less as a bolt-on service that they're providing today, but it hasn't been integrated with their strategy. It's not integrated with the way they're operating as an organization. It's more or less maybe it has been up until now kind of an afterthought, a nice to have, something that they have as part of their service portfolio, but perhaps not as much of a focus as some of the in-person models. But then when you move all the way to the right side, when you look at organizations that are in what we consider the optimized phase, these are ones that have already really embraced the digital health strategy piece. So they have fully integrated telehealth into their entire business operating model. So everything when you're looking at how they're scheduling, how they're operating as an organization, how they're billing, how their providers are providing services, how they're tracking and monitoring patients. It's a fully integrated solution within their organization. And these, from our experience, are probably some of the larger health systems, the larger physician practices, but probably skewed more to the health system standpoint that have been doing telehealth for years already and have been really well positioned in this current environment to just kind of probably ramp up those services a little bit more. But they've got all the kind of building blocks in place. So this is that's a broad overview of the 3 phases of organizations as they're moving along the maturity model. Our thought is that there are 7 core competencies that organizations need to think about building, and then they mature them as they kind of move along the spectrum, if you will. So starting with telehealth strategy, which is the focus of the next part of our conversation and really the focus for today. So how are they taking that and really thinking through what are the goals of the program? What are the objectives? How are they looking to drive changes in behavior? How are they really integrating that with their overarching strategy within their organization? And Sarah will go into that a little bit more in a few minutes. That's the first component. Then there's cybersecurity and compliance. So how are they thinking about HIPAA compliance long term? How are they thinking about risk management? How are they thinking about the safety of the information that is being stored and disseminated and used by clinicians as part of risk management, et cetera? So how are they building programs around that? The infrastructure and information. So what sort of IT solutions are they using? Is there interoperability between their different pieces of technology, whether it's their telehealth product and then maybe some of the peripherals that they're using to monitor patients remotely, depending on the maturity of their organization? How are they using these different pieces of technology in an integrated way within their organization? We've talked about payer contracting. We've talked about payer reimbursement mainly on the federal side, but how are they also coordinating with their commercial payers to think through what the reimbursement looks like long term? Are they starting to have conversations with their payers? We heard anecdotally this week from several clients that are having trouble reaching some payers just given the I'm sure influx of calls that they're getting. So how are they kind of looking proactively at how they're starting to think through what their payer strategy should look like in the future as they're putting this as a core service offering within their portfolio? What are some of the other financial strategy and modeling capabilities that they may have, that they will need to have in the future? So looking at how they build this into a profitable piece of their business. Are they looking at separating telehealth as a different cost center within their organization. There are a lot of things that we think they need to be thinking about from a financial standpoint. How are they building core competencies in the revenue cycle management area? So that impacts most obviously kind of how they're coding and billing for the services, but are they looking at the edits in their scrubbers? Are they looking at how they're scheduling? Are they looking at the pre-authorization process? I was talking to somebody the other day, this reminds me of work that we did years ago when we were going through the ICD-10 transition and where you were looking at every piece that the code would hit. This is kind of similar as you're looking at your revenue cycle. This is going to have dramatic impacts to your revenue cycle over time. So how are you looking at the different pieces of that? And as you're maturing your organization from a telehealth strategy, and then from an operational efficiency standpoint too. This is going to change productivity standards in a lot of ways. So how are you looking at measuring your productivity measures as an organization? How are you looking at your staffing models as an organization? This could have dramatic impacts on that over time. It could have impacts to what your space requirements look like. There are a whole lot of different pieces that it could impact. And we're not proposing that organizations need to focus on that kind of overwhelming list today. We understand that we're kind of meeting clients where they are in their journey, but there are things that they can start thinking about that they can then build on in the future as they're building additional capabilities as an organization. So we see this very much as a journey across the continuum in a lot of ways, and it's not going to be kind of something that you achieve on day one, but how do you take what you're doing from a response mode today and start to look around the corner and see where you can start addressing some of these pieces as you're building your telehealth strategy. So I think we can go into a little bit more detail about the telehealth strategy piece. I'll turn it over to Sarah to talk through that.
Great, thanks, Heather. So as Heather talked about, in this maturity model we've created, there are a number of core components that we think are critical for organizations to be thinking about now in the response mode, but also be preparing for and considering as they think about their long-term sustainability as it pertains to telehealth. So in the series of recordings, podcasts that we are releasing, we will discuss what we're seeing across the industry as it relates to each of these core components. Also recognizing, as Erica talked about, we're in a rapidly changing environment. Providers are responding now to regulatory changes happening, but they also will need to address how the business model has changed for the future delivery of healthcare. So in these series, we will talk about some best practices we're seeing, some key considerations for future planning, and where we think telehealth will go in the future. And as regulatory changes happen, we'll make sure we're providing the most up-to-date information for you all. But in this first podcast, we really wanted to focus on a telehealth strategy. So thinking about the way in which an organization deploys their telehealth capabilities to consumers, both on the provider side and the patient side, and even the family side. So how we're seeing telehealth services help patients connect to their family members who they may not be able to see face-to-face. And also consider how telehealth fits into a larger digital health strategy for organizations and how organizations position themselves for future success. So if we put telehealth in the view of a broader growth strategy or partnership strategy for provider organizations, how is telehealth helping to support providers in those strategic initiatives, and how, as a standalone initiative, how is telehealth being deployed? So that's kind of this first core component that we are focused on. And as Heather talked about, in this maturity model, providers will mature and progress along a continuum as it relates to telehealth strategy. We believe there are some core capabilities that fit within a telehealth strategy, which we'll address on the next slide. But really, when we look at the initiate phase, the develop phase, and the optimize phase along this continuum, there may be certain progress made in certain components and certain capabilities as it relates to telehealth strategy. So in an initiate phase, organizations may lack a unified vision around telehealth, especially as responses are happening so quickly. It's a response mode, and potentially come back and address the vision of how we want to perceive telehealth for the long term. But as we get into more of the optimized phase, we've seen and believe organizations will think about their telehealth strategy and the broader perspective of where they want to go as an organization. Kind of why are they delivering telehealth services, and where do they want to take those services in a broader context? And how do they want to use telehealth to continue to advance their organization? We also see a continuum along the resource commitment. So early on in the initiate phase, it may be no dedicated resources, but as we get into the develop phase, organizations and providers may start to commit more resources to developing a telehealth strategy and delivering telehealth services. And finally, having a champion. We've seen this in any type of strategic planning initiative. Having a champion to really take a hold and take ownership of a telehealth strategy really starts in the develop phase. But as we get into the optimize phase, you can see this champion, and there may be multiple champions as it pertains to telehealth, but really taking ownership and being able to connect telehealth to other pieces of an organization, making sure that they're providing feedback to leadership on the performance of the telehealth strategy, but developing a comprehensive way in which the organization is delivering their telehealth, I think is critical for success for organizations in the long term. So that's the core component. As we continue with these recordings, you'll see a similar structure. Each core component has a common definition, and then we've broken down into some key capabilities. As it pertains to telehealth strategy, we've defined really 3 in here. So consumer engagement, both from the provider side and the patient side. So how are telehealth services being communicated to consumers? Do your patients know that you offer telehealth services? How can they access them? When patients call to schedule appointments, are you offering to schedule a telehealth visit rather than having them come into the office? From a partnership and growth perspective, how is telehealth fitting into that strategy? Can you look at partnering potentially with other provider organizations to deliver telehealth services? Or from a private equity side, do you look at your telehealth strategy as another value add for your organization? And then finally, change management, which I believe is so key internally for organizations for long-term sustainability of strategies. How are you communicating to your team members and to your staff the changes that are happening from a telehealth on a broader perspective, but also for your specific organization? What changes are you making to deliver and launch and deploy telehealth programs? And that constant communication and feedback. I think sometimes team members have the best strategies and some of the best ideas, so making sure they feel ownership and involved in the telehealth strategy. So as we think about this first component, those are the key capabilities we're seeing. And now we get in really to the fun part of this recording, and I'm going to put Matt, Heather, and Erica on the spot with some questions just to get their perspective on what they're seeing in the industry, what we're seeing what our clients are asking us, and how we've seen our clients respond. And then finally, how should we all be thinking about telehealth in the long term, and what are some long-term considerations? So Matt, you're first up. How are you seeing providers respond to this changing industry, and what initiatives are you seeing them deploy in this response mode?
Thanks for putting me on the spot, Sarah.
Yeah.
So we're kind of, if I had to say sort of the biggest sort of initiative or approach that providers are taking is this sort of a Band-Aid approach to just get a telehealth program up and running. And as others mentioned, it's primarily through the use of the path of least resistance, which is not using sort of HIPAA compliant software or otherwise building in telehealth capabilities within their larger operations. So not integrating with their EHR, not integrating with their billing technology, where they're simply just using your Zooms, your Facebook messengers, or FaceTimes in order to do a telehealth visit. And not necessarily thinking about how it should really become part of their overall operations. And I think because of that, one of the key questions or questions that we continue to get asked, and Erica, I'm going to throw this one over to you, is, you know, providers will say, well, we're doing telehealth visits now, but how do I get paid for them? Or how can I sort of increase the likelihood that I get paid for them? And so from the reimbursement side, both federal and commercial, what are some of the types of questions that you're getting and that you're seeing out there?
Yeah, so this has been an exciting time for practitioners who are interested in telehealth because of the expansion. At the same time, it's been an overwhelming and frustrating time because the changes are happening so rapidly that they're hard to keep up with. So we're seeing a lot of questions around the proper way to document services and to code for services. We're seeing a lot of questions around the audio only versus audio and video component, when it's okay to bill for an audio only telephone call and how it can be billed. So that's a big one. And I would just add to the point that Matt just made, that especially because we think that the enhanced reimbursement for those codes probably won't last, even if you can figure out how to build them correctly now, it is well worth thinking about the technological changes you might want to make going forward to allow your patients to access video if you can, because it's very likely that that will allow you to get the full reimbursement for your visit going forward. So definitely something to think about. Another big question that we're getting is around supervision requirements. What level of involvement a doctor has to have when another practitioner is on the phone to meet supervision requirements. That's tricky with telehealth because it's such a different situation from working in your office suite when often your staff is all there together. So that's a big one. And as you can imagine, have probably experienced if you work in this space, those changes relate to Medicare rules. Every payer's got slightly different rules around coding and documentation. Those rules were different before COVID-19, and now as Medicare is changing so rapidly, some payers are aligning and some aren't. And so the environment's gotten even more complicated payer to payer. So a big challenge for a lot of the clients that we work with is figuring out how to keep track of and line up with all those different payer changes now and as we move forward.
So Erica, I totally understand there are a lot of changes happening. It can be hard for providers to keep up with all these changes. So how are you recommending to your clients to keep up both with the CMS regulatory changes and the commercial payer changes? What kind of are some tactical recommendations or what you've seen kind of across the industry to keep up with all the changes that are happening so quickly?
Yeah, and part of it, which is, I realize sort of frustrating advice for everybody who's trying to work in this space, is really to be on top of it, be watching for alerts from agencies and from payers directly, from the law firms and consultants that you work with. We're certainly tracking all these things very closely and trying to help our clients stay on top of them. So be watching that stuff and make sure that if you're, for instance, in management, you're watching the stuff that's being communicated down to the chain of your organization. So it's not just that you're aware of it, but it's that your billing department is aware of it and they're being educated quickly about all of these changes because there's no other way for them to keep up. The other key thing is just document everything that you're doing, document why you're doing it, document it completely. Because at the end of the day, nobody's perfect. And when things are changing this quickly and are this complicated, almost everybody's going to make some mistake somewhere along the line. And the better you document what you've done to try to keep up with everything that's happening, the services that you've provided, the way that you've provided them, and the reasons that you provided them in that way, the more likely it is that if you do make a mistake, it's possible to find and fix that mistake if you need to, and to explain it if you ever need to a regulator. So documentation is so critical right now.
Great. Thank you for that. So I think Matt and Erica both touched on kind of short-term responses of what we're seeing in the industry right now and some regulatory changes and some considerations. But Heather, I want to turn to you. And as we look towards the future and what's to come for telehealth in the industry, what should providers be thinking about and why should telehealth strategy be kind of at the forefront as it relates to strategic planning and visioning and as they think about budgeting and their resource commitment?
Yeah, that's a great question. And I think this needs to become one of the core components that they are considering as part of their organizational strategy. I mean, when we work with organizations, they typically have several areas that they are very focused on. And I think this needs to be one of the top strategic areas moving forward, because I think it's going to be that important to their, especially, well, really across the board. I think it's going to, I think we feel pretty strongly that telehealth is going to change the practice of medicine in virtually every setting moving forward. So how are they considering that as they're integrating with their strategy, their larger strategy within their organization? It has to go from becoming an afterthought or being an afterthought to becoming an integrated part of their strategy. So we went through 7 areas that I think they need to look at from a maturity model standpoint, but there are a couple of pieces that I think are really important for organizations to start thinking through pretty immediately. One being the technology solution. So we've talked at length about how people are kind of using, in a lot of ways, the path of least resistance right now for a lot of reasons as they're getting to market very quickly. We do think that some of those relaxed regulations will likely go away. So how are they starting to look at the technology solutions that fit best with their individual business model? There are a lot of different solutions out there. And I personally think there are probably going to be a lot more solutions probably coming out of this, because it's a great growth area for technology organizations. People are pumping a lot of money into solutions like that today. So how are they starting to think through what their requirements for a technology solution would look like, how they're starting to investigate vendors, how they're even starting to go through that path? Because what you may find is down the road, once the immediate regulations are, I guess we go back from the relaxed nature of them, there are probably going to be some pent-up demand. And so getting a new solution in place may take a little bit longer in the future. So I think that's one of the things people need to start looking at today. You hit on the change management component. And as someone that has spent much of their career driving large-scale transformational changes, I don't think that can be overstated. This is a complete change of behavior kind of across the board. You are changing the way patients interact with physicians. You're changing the way physicians are practicing medicine. You're changing the way that the support staff within offices are operating in some cases. I think being very specific at investigating what those changes look like and what kind of communications you need to wrap around those, and education being key. We haven't talked about that a lot today, but I think the education across the board of the different stakeholder groups is going to be key, and it's going to really define how successful you are with a telehealth strategy. I think that's another piece of it. And then this to me is kind of goes without being said, but I'm going to say it anyway. Working with your payers and working within your organization to determine, and this is where kind of financial modeling and some of those financial pieces come into play, how this can be a profitable part of your business moving forward. We've talked about the enhanced reimbursement in a lot of areas. We'll see if all of that stays the same. We'll see how commercial payers follow or don't follow what Medicare and Medicaid do in the future. I think there are a lot of unknowns related to that, but this, as it becomes a core part of your business, it's going to have to be a profitable core part of your business, or at least can't be, you have to figure out a way to make it a profitable part of your business moving forward. And how does that affect your staffing models? How does that affect a lot of different pieces of your business? So how do you think through that? I mean, there's no easy answer to that today. I mean, that's why it has to be an integrated part of your overarching business. But those are a couple of things that I would encourage organizations to start thinking about.
Great. That's really helpful. And I think, Heather, we would agree that there's no time like the present to start thinking about that and planning. We've talked about the maturity model being a continuum, and I think beginning to think about these long-term considerations and how providers are going to be delivering healthcare once this pandemic is over, and as we start to kind of transition out of it, starting to think about that now better positions organizations for the future. So I have one last kind of rapid fire question for all three of y'all. In 5 words, really, or less, what do you believe are the top, or what is the top thing that, and I know 5 words may be hard to limit to, but what is the top thing that you believe providers should be focusing on right now as it relates to telehealth? So Matt, I'll start with you.
I mean, I think on some level, and I'm probably going to blow the 5-word restriction here, it's really some of the key points that Heather mentioned. And I guess it'd really just be focusing on strategic planning and communication, and making sure that you're using those sort of two key components, and which have been fleshed out here, and really building that into your model.
Great. Heather?
Well, I'm definitely, I was trying to rack my brain to get into 5 words, and it just became gimmicky. So I'm going to try, I think we've talked about a lot of the things that I think are important, but I wanted to circle back to the integration with the entire revenue cycle and kind of the operational components of it. I think I'm way over 5 words now, but revenue cycle, integration, and operations, they're 5, something like that.
There you go.
And yeah, there you go.
Erica?
So I'm going to try and do it in 2 words, but then add a bunch of other words afterwards to explain it. So I'm an attorney, I can't help myself. But my 2 words are patient demand. And the reason I say that is right now a lot of providers who have never before used telehealth or haven't used it very much are now using it much, much more. And this is an amazing opportunity to communicate with your patients about what they like about that, what kind of services they want to receive via telehealth. And that's going to allow you to think about what's going to work for your practice, what's going to work for your patients, what changes do you need to make for this work for your patients, what do you maybe want to be talking to regulators about? Because one thing that's been, in my view, almost unique about the COVID-19 pandemic is the dialogue that it's created between the provider community and CMS. So there's a real opportunity right now, if things are working well in your practice, to be letting regulators know about that, so that if CMS decides what to move forward with and what not to move forward with, they're aware of what you're hearing from patients, because that's something they care a lot about, and it makes a huge difference, of course, to all of you.
Great. Thank you. I think those were all great points. A little over 5 words, but I mean, we're attorneys and consultants, and so I think that's understandable. The last kind of part of this recording, I'm going to pass it over to Heather, but I know we've thrown a lot of information out, and we've talked a lot about the regulatory changes. We've talked about the telehealth maturity model, and then focused on the first core component around the telehealth strategy. And so you may be thinking to yourself, well, how am I going to figure out where my organization stands right now and where my gaps are in delivering telehealth services and building a sustainable model? So Heather's going to talk to us a little bit about kind of next steps from here.
Thank you, Sarah. So what we've tried to do is put together a telehealth series of recordings that we're going to be rolling out in the coming weeks, where we'll have each of them focused on one of the core components and the core competencies that we've talked about today. What we're going to do is pull in different SMEs from both of our organizations, and even perhaps outside, depending on the topic, and go through what are some of the things in a very tactically focused conversation that organizations can start doing today to address these different areas while kind of continuing to look around the corner at long-term building capabilities and maturity within their organization. So we've got a 7-part telehealth series that we're going to be rolling out in the coming weeks. And you can find more information on that. Both of our websites will also be sending out email blasts. And on the next slide, we'll provide some contact information, but there'll be more to come on that. And so we'll be focusing on those 7 areas that we've outlined. The other piece of it that we're really excited about is the telehealth readiness assessment. And this is a short online assessment that we're rolling out to organizations. It's open to any healthcare organization. And what we're going to ask you to do is provide some information on your organization, very specific, what you're doing today, what you're doing in relation to some key questions for each of the 7 components. And what we'll do then is we'll take that information and we'll start to analyze it, and we'll provide you with a short report of some of the things that we think your organization in particular can start looking at as you're building maturity within your organization. So that should be going live at the same time as this audio recording or video recording, I guess. I'm learning all my technology terms with this, but it should be accessible in the same medium that you access this recording. So if you got it through our website, there should be a link there. If you got it through an email blast, there should be a link there. And we're really excited about this telehealth readiness assessment. We are hoping to also then be able to provide some benchmarking across organizations and drive some other communications in a very targeted way coming out of that. So just to wrap up, we appreciate you guys giving us some time to speak with you today about where we see the telehealth journey going and some of the regulations that are driving it and where we think organizations need to be focusing on both the short and long term. Matt and I are available if there are specific questions that come up. We look forward to interacting with you in the future, and please stay tuned for more information from both of our organizations. Matt, Sheppard Mullin has a website developed, part of their website devoted to the COVID-19 response. We do as well, so we'll both be posting a lot more information as it becomes available. So thank you for spending some time with us today.